Okay. Good morning, Andrew.
Hi.
My name's Andrew. I'm a student physical therapist. Today I'll be the one looking at your knee.
Okay.
Would you mind just describing for me what brought you in today?
Uh, what brought you in today, sir? You're in my house. But anyways, my doctor said that I got some funky thing going on in my knee.
Keep going.
I'm not too sure what he meant. He said some kind of uh arthritis. I don't know what.
Osteoarthritis.
That's what it was. Yeah.
Did he describe to you what osteoarthritis is?
Well, he says something about like inflammation, and when I think inflammation, I think it's just growing or like just pissed off.
Mm-hmm.
But he said something about that, and he said that I should really start getting some exercise in. So I guess that's why you're here.
Yeah. So we'll go through so osteoarthritis really quick before we get in any further is it's just some degeneration of it's a natural process though of some sort of degeneration, but the tissues that cover the bone start to thin out and it kind of exposes the bone a little bit more. One of the great things though about physical therapy and exercise is that consistent exercise and movement will help to increase nutrition and fluid balance for those tissues and can actually help it stay healthy.
Okay.
So that's something that we'll talk about as we go through our plan of care today. Is just getting you to move a little bit more, and that should help to decrease some of that pain in the knee.
All right.
And then, sorry to cut you off there, but so we just talked about OA. Does your doctor have any other diagnoses that he's talked to you about?
Well, I am a little bit on the larger side. Doctor said I'm obese according to his BMI scale. I have high blood pressure.
Mm-hmm.
I have diabetes. And but all of that is pretty good. I'm taking medication for everything, so it's managing.
Okay.
Yeah.
And your doctor's making sure that your meds aren't overlapping, making sure that they're not making you drowsy.
Yeah, they're all from the same. I've been feeling good.
Good.
Yeah.
Excellent. Okay. And then so kind of before we get started looking through the exam, before we go through and talk more about what's going on, is there anything that you'd like to get back to, or anything you feel yourself limited with?
Well, I like to spend time with my wife, and we used to go on these bike rides, and I think it really helped us just both emotionally and physically if we can get on those things again. So I guess that's what I want to get back to.
Getting back to bike riding with your wife?
Yeah.
Excellent. Okay. Alrighty. So, before we get started, I'll just describe to you what's in in our exam. So first we'll start with the history, which is what we're going through right now, where you're telling me kind of about your past medical history, things that are going on currently with your knee, that sort of stuff. And then we'll kind of take a look at you as a whole. Mm-hmm. So kind of a top to bottom assessment, make sure things are good. And then I'll get a few measures for myself so that we have a way to assess and reassess how you're doing as we go along with our plan of care. Does that sound good?
Sure.
Excellent. Okay, so with our history, just a few things that I want to follow up with, especially with your diabetes. Is it type 1 or type 2?
Oh, it's type 2.
Type 2?
Yeah.
Okay, how long have you had it for?
It's been a few years now.
It's been a few years?
Yeah.
Okay. You say around like 3 or a little longer?
I don't really remember. Yeah, about 3.
Okay, about 3 years?
Yeah.
And then has your doctor talked to you about regular skincare, checking your feet and that sort of stuff, making sure if you experience any sort of numbness or tingling that you talk to them right away?
Yeah.
Excellent. And so you're doing routine skin checks on your feet?
Yep, and I wear white socks too.
Perfect. So you're making sure that it stays nice and dry and that sort of stuff? Awesome. All right. And then when you're at home, you said you have a wife. Is it just you two currently at home?
Yeah, and our dog. Oh, speaking of our dog,
Okay.
I accidentally tripped over him the other day, and I ended up falling
Okay.
straight to the ground.
Okay. And any sorts of injuries, bruises?
Nope.
Nope.
I just fell over. I didn't see him there, and I didn't really feel him there either, so tripped right over him.
Okay. And do you have any fear of falling in the future, or do you think that was just kind of a fluke?
I'm a little scared. I think it has to do with me being not able to react as fast.
Okay.
So I think if I'm a little bit stronger, I can get my muscles moving a little quicker.
Awesome. And that's something we'll definitely look at doing.
Okay.
Get you a little bit more functional.
Mm-hmm.
Make you feel a little bit more confident in your surroundings and that sort of stuff. So going back to at home, you've got your wife and your dog. Do you take care of yourself? Is it kind of a team effort between you and your wife?
She helps me a lot.
Okay,
Mm-hmm.
awesome. And then along those lines with nutrition, do you feel like you're eating a good balanced diet? Could you be doing better? Have you talked to a nutritionist?
No, I haven't. I think I could be doing better though. Yeah, I'm not proud of it, but I just ate some pizza and do that kind of often.
Okay. And your blood pressure or your blood sugars, you monitor them with each meal?
Yeah. I mean, I pop that pill that I'm supposed to take, and I hope it just handles itself. Really.
Okay. All right. So I don't want to mom you here, but nutrition is something that's important. Along with physical exercise, good nutrition can help with things like our joints and our bones. So that's something that we can talk about if you're interested in it. Or I can refer you to a good friend that I have who's also a nutritionist who's excellent with people with diabetes and who are slightly overweight, getting them on a good plan to feel more healthy.
I think we'll start off with what you can do first, and we'll work from there.
Okay, we can discuss that kind of throughout today as we go along.
Okay.
And then, I think that kind of covers our history here. We're going to look at a quick review of systems. So I'll start with your skin, make sure everything looks good. Do you mind if I place my hands on you kind of just to feel around and make sure things don't feel abnormal?
Go for it.
Okay, thank you. All right, so we'll just take a quick peek. Legs look good, arms look good, no signs of cuts, bruises, scrapes. Anything going on with the heart at all? We talked about the high blood pressure, but nothing else going on there?
Nope, nothing.
Good, and no nerve issues?
Yeah, I get a little bit of a tingly sensation on my feet sometimes when I'm standing up too long, but nothing.
But it resolves itself?
Yeah, after I sit down.
Okay.
Mm-hmm.
Okay, and then anything going on with the bowel or bladder?
It works pretty well.
Okay, and then I know this can be a touchy subject, but in terms of sexual function, you feel like you're doing okay?
Just ask my wife, you know what I'm saying? Yeah, we're doing good. We're doing very good.
Okay.
Yeah.
All right.
She's still around.
I'm glad you have a good sense of humor with that.
Mm-hmm.
Just want to get a good kind of feeling top to bottom how you're doing. And from here, before we get started, I'll assess kind of some gross motor function and make sure that skin's feeling okay. All right?
Okay.
All right. So to start, we're going to just check and make sure things feel normal on each side. And so I'll touch the same spot on each side. You let me know if it's same or different.
Okay.
Okay?
Same. A little off, but same.
Okay. Well, when you say a little off, was it a little off on the right side or the left side?
Right side was a little bit less sensitive.
A little less sensitive on the right?
Mm-hmm.
Okay. So I'll just take a note of that and we'll kind of monitor that as we go through, okay?
Okay.
And then let's check your overall strength. So we'll start with the left side and kind of go left, right.
Okay.
Sound good?
Yeah.
All right, so I'll have you lift this knee into the air.
Okay.
And hold there. Don't let me press down. Good. And then go ahead and lift up here. And hold, and relax. Excellent. And then I'll have you kick up with this leg. And hold there. How's that feel?
Feels alright.
Good. And then I'll have you kick up here and hold. A little bit weaker there, That's okay. Then let's pull our toes towards our nose and pull. Perfect. And then hold. A little bit tough there. Okay. And then I'll just a quick one, I'll have you pull back into my hand. Excellent. And then same thing over here. A little bit tougher.
Yeah.
Okay. And then same thing, press into my hand down here. That feels okay. And then press down. Good. All right. Let me get my reflex hammer real fast. So this is kind of our neurovascular screen, making sure that things are looking okay. So overall, kind of as to be expected with the diagnosis of the early onset OA. Just some diminished musculature over there, but it's nothing that PT can't handle.
Okay.
So now we'll just test your reflexes real quick.
Okay.
All right. Go ahead and close your eyes. Any pain there?
That was a little sore.
Okay. All right.
Ah!
So is that painful or is it surprising?
That was just surprising. It caught me off guard, yeah.
Okay. All right, and then we'll check back here. Okay. So normal.
Yeah.
Alrighty. Normal. Normal. Good. All right. So we've got kind of a good background. Things seem to be working pretty well. Reflexes are fine, kind of to be expected. Just some weakness on that right side. But we'll go through some interventions at the end, things that can help you improve the strength there and improve your balance as we go. Okay. All right. So before we get started, just a couple questions. So the two tests that I'm going to perform with you are a 2-minute walk test and a 30-second sit to stand.
Okay.
So one of them requires you to come up from a chair to standing. Do you have any pain in the knee with that?
Only when I do a little too much that day.
Okay.
Like towards the end of the day, but I mean it's still early. I think I got it.
You think you got it? Excellent. And then any pain or decreased confidence with walking in a change of, or walking straight and then changing direction?
No.
You feel fine?
Yeah.
Good. All right. So I'm just gonna stay close to you as we do these. I feel comfortable with you not having a gait belt on for now.
Okay.
But we're gonna check your vitals beforehand, and then we'll go ahead and start with those 2 assessments. Okay.
Okay.
Thank you for rolling up your sleeve. And then I'll have you put our heart rate monitor on. And it'll monitor your heart rate as well as the amount of oxygen that you have. And then before we get started, we have what's called an RPE scale, or a rate of perceived exertion scale, from 0 to 10. 10 being the most physical exertion you've ever experienced, and then 0 or 1 being kind of the easiest thing that you've done. As we go through and do the exercises and do the tests, I'll have you report to me how you're feeling, and then that way we can kind of assess where you're at and record that, and then use that in future progress notes. Okay? So we'll make a note of what's going on right there. Excellent. Things looking good. Normal heart rate, it's about 70, and then oxygen levels are normal as well. And we'll go ahead and take your blood pressure. Let's make sure these are in my ears correctly. Hmm?
Am I okay?
You're okay, but you do have what your doctor described as high blood pressure.
Okay.
It's about 140/85, which is okay. And then, so from there, I'll have you set this up so we can see it here. All right. So Andrew, I'll have you go ahead and stand up. And we'll just take a seat in the chair. Perfect. All right. And then I'm going to describe to you what the 30-second sit to stand is. So during the 30 seconds, I'll say go with your arms across your chest. You'll go ahead and sit up and stand up and sit down as fast as you can and as safely as you can.
Okay.
And then we'll record the number that you get to, okay?
All right, I can do that.
Let me grab my timer real fast. All right, so go ahead and lean forward and slide your bottom to the edge of the chair there. Perfect. And then when I say go, you'll go ahead and stand up and sit down as quickly and safely as you can, okay? All right. When you're ready, go ahead, go. 1, 2, try to keep your head up. 3, 4, good. 5. And during this, what I'm assessing is his overall strength of his lower extremity, seeing if there's any abnormalities as he goes from sit to stand in his knee at all, if there's any wobbliness or weakness. And stop. Good. All right. So on that RPE scale of 0 to 10, how would you say you're feeling?
Like a 6 right now.
A 6 right now?
Yeah, maybe a 7. 7.
7. So that's kind of, as you get to the end of the day, things start to get a little bit more difficult to do.
Yeah.
Okay. So we've noted his heart rate, which is in a normal range and to be expected with an increase in activity. And then we'll go ahead and take his blood pressure. Go ahead and relax. Lean back. Perfect. And we have a normal response to exercise, so nothing to be too worried about, just an increase in his systolic and diastolic as expected. So we'll note his RPE and his increase in blood pressure, see if as we get into our program of improving his endurance as well as his strength, will help to decrease the response that his blood pressure has to just 30 seconds of exercise. So during that, we noticed he had some wobbliness in the right knee. He kind of favored his left side to offload that right side. So definitely some things to improve upon. And then with this, the number you got was, let's say it was about 10. And for your age group, less than 12 is indicative of falls. So as we progress and get you going with our exercise plan, I'd like to get you above about 14, which is normal for your age. Does that sound good?
Yeah.
Good. Good. Excellent. Definitely a doable goal. And we'll talk about your plan of care as we finish out these two outcome measures here. So our next one is the 2-minute walk test. I've set up a course behind the camera for a certain distance, and he'll walk back and forth for 2 minutes. We'll record that distance and make a note of it, as well as how he's feeling throughout with the RPE scale. And then after that, we'll talk about it again. We'll go through what I believe is going on with you in terms of muscle strength. We've kind of touched on that already. and then we'll get into go ahead and doing some interventions, and we'll send you on your way with some exercises to do, and hopefully you'll be feeling comfortable doing those at home. Okay. So our next one is the 2-minute walk test. We'll go ahead and stand up, and then I'm gonna move the camera. Carefully stand up.
I'm so sorry. It's so dark in here.
Thanks for turning on the light there. All right. Let's go ahead and turn around. You feeling okay?
Yeah, got up a little too fast.
Okay. Any dizziness there?
No, not at all.
None at all. Good.
No, I'm ready.
You ready to go?
Yeah.
All right. So we've got our timer here for 2 minutes. We'll go ahead and walk back and forth as quickly and as safely as you can. We'll measure our distance. You can go ahead and get started, and I'll keep talking as you go. Good. And go ahead and turn around there. So the whole time I'm gonna be kind of on contact guard in case he does need some assistance. But what this is telling me is if he has any antalgic gait or discrepancies in the way he's walking. And this is a better assessment of his aerobic endurance as well, which will be important because he wants to go on bike rides in the future. And then additionally, this is longer than the 30 seconds, so it'll give us a better estimate of how he responds to exercise in total. And then this one, it's just kind of something that he can do and as part of a walking program that I'd like to incorporate into his plan in the future. Good. We'll go ahead and turn around. And again, we're going to use the RPE scale to ask him how he's feeling. So on a scale of 0 to 10, how are you feeling?
I'd say about a 7 right now, yeah.
A 7 right now?
Yeah.
Okay. Make sure you're breathing in through your nose, out through your mouth.
Oh man, I brought it up to an 8 for a quick second. I'm okay though.
Okay. So we'd like to stay within that 6 to 7 range on the RPE scale. That's our acceptable range for activity for him. We've got another 10 seconds. Perfect. We'll go ahead and mark that there.
Okay.
All right. And then Andrew, you can go ahead and take a seat back in the chair. We'll finish up with just let's go sit on the table.
Okay.
We'll finish up with some exercises and a quick chat. All right. So let's go ahead and finish off with our blood pressure, heart rate. And the whole time I've been kind of taking measures of his respiratory rate, making sure that it's normal, which it is. He's breathing through his abdomen, which is a great sign. And it's not too shallow, it's not too deep, and it's at a normal rate. Heart rate has the same increase as it did for the 30 seconds sit to stand, which is normal, especially after exercise, seeing a slight increase. Awesome. And at no time did his oxygen levels dip at all. So everything seems to be checking out vitals wise. I feel comfortable with him sending him home with an exercise program and performing it himself without fear of him fainting, becoming dizzy, or any sort of emergent situation that could occur. So I would tell him that. Andrew, we're aiming for about 163 meters, which is a norm for your age. You were slightly below that at about 140. So you got about 23 meters of improvement that you can make, which is actually something that's really great. It'll give you a goal in terms of like an actual measure for you to do, instead of saying that you want to play with your grandkids or riding your bike, which is awesome. But we're actually putting a number to it so we can track your progress along the way. Okay, nothing to be ashamed of. That was a really good performance. It's just something that we can look forward to improving and getting better at. Okay. All right. So what I saw with those two tests was just some weakness in the quad on the right and the glutes on the right. You did display some antalgic gait where you tend to lean off to the left to offload that right side, kind of in the same fashion that you do when you're doing your sit to stand test. So definitely room to improve. We had your RPE throughout the whole thing, kind of stayed around that 6 to 7 for both. So we'll keep that in mind as we progress and get you doing more exercise. Your RPE should decrease as your endurance improves and your strength improves. Okay? All right. So one last thing before we start our interventions is our education. So again, to reiterate, just walking, strengthening is really good for your joints. It helps to provide that nutrition that the tissue needs in order to stay healthy. It also helps to modulate any pain response, so that can help with your pain levels there too. Additionally, by strengthening up the muscles around the knee, it'll help to offload it, and it'll help you feel more confident in your day-to-day activities. Okay. All right. So our two exercises that I'd like to do with you are a mini squat and a clamshell. The mini squat is going to be functional. It'll help you strengthen your quads and your glutes. It'll help you to feel more balanced and centered. And then the clamshells will help to strengthen up the glute medials, which help offload some of that weight and keep you better balanced. And there's your dog.
Yeah, there he is.
There he is. All right. So we'll go ahead and get started with those. I'll print out a sheet with those exercises for you. But we'll get going our way since we're kind of running short in our on our time here. Okay.
Okay.
All right. So Andrew, I'll have you go ahead and stand up. We'll go ahead and face the table so that you can have your hands on the table. Good. And let's stand up nice and tall, feet shoulder width apart. Good. And what I'd like for you to do is bring your keeping your knees over your toes. Let's go ahead and bring your bottom back just a little bit, and then right back up. Staying up nice and tall. Good. Down and up. We'll start with about 10 of these. And these are going to help to strengthen the quads and the glutes. Again, I can help to increase or decrease these. I can increase the amount of distance that he's moving in. I can have him hold weight, or I can even have him holding onto a TheraBand up here to make it easier. So again, for time's sake, I won't monitor vitals except for heart rate during this. And then, so how are you feeling with those, Andrew?
Last one.
Last one?
Yeah.
Good.
Yeah.
Right back up. Okay. So we'll start with that 2 sets of 10 of those for home. You can go ahead and take a seat now. And I'll print out all the instructions here for you. And then our last one is a clamshell. We'll pretend like we have a band.
I like clams.
You like clams?
Yeah.
To eat?
Yeah.
Awesome. Alright. So let's go ahead and lie on your side facing me. We're going to do both sides for the clamshell.
Okay.
So for the clamshell, what I'll have you do is stack your hips perfectly and keep your ankles perfectly stacked, feet in line with the back. Awesome. And what I'll have you do is lift your knee up, squeezing your bottom. Good, and hold for 3 at the top. 1, 2, 3, and down. So nice and slow. And the purpose of these is to work on that glute med, strengthen those up so that you feel more confident in with your hip, which is the joint over the knee. Strengthening that up will be good in general. We'll send you home. So you're going to raise for 1 second, hold for 3 at the top, and then slowly lower back down. We're going to work both sides equally, making sure that we're focused on the strength of both sides. Again, this should help with his goals of being able to play with his kids, staying upright with his grandkids, playing with his dog, and then the biking as well, because our biking requires our glute max and our quad in order to use the pedals, and for balance. Again, monitoring RPE with this. To make it easier, I could have him turn on or lie on his back, and that'll take some of the gravity away. And then to make it harder, I can add a band or an ankle weight around the knee. There's tons of things that we can do to challenge him. Have high hopes for him in the future. Let's go ahead and sit on the edge of the table. I think prognosis-wise, he's good. He's highly motivated to get back to being active within his family. He has the means to do so. He's ready to talk about his nutrition. And he's excited to kind of get back onto the path of being healthy and strong. So overall, I feel like we can help Andrew quite a bit in pursuing a healthy lifestyle, improving the pain in his knee, as well as improving his overall health. Any final questions before we log off here, Andrew?
Did you like my dog?
I loved your dog. This is a very cute dog. Okay. All right, Andrew.